Let's begin with the knee joint. So, knee is one of the most complex joints in our body. Although it seems very simple, there is one bone above, one bone below, but it's not that simple. It can flex, extend. Flex means it can bend, and it can extend and twist also from side to side. So you can twist also a little bit, and they make it possible for us to walk, jump, run, and bend. And since there is a complex range of motion, the weight that's often distributed through the joint, the knee is vulnerable to injury. Okay, so if you see this, you should know what your knee consists of. So in the front, the hard surface which you see, it is the patella. That is also a bone. And this muscle which you see from top is the quadriceps muscle, and it gets attached to this lower bone which is known as tibia. And this the upper bone is known as the femur, and it is these two bones are held together by ligaments which are known as anterior and posterior cruciate ligaments, which is here. Cruciate means cross shaped, and then there is also these lateral collateral ligaments which are there. So just to simplify, you understand that these two bones are held by some ligaments, and they can be torn. So the function of the ligaments is to hold the bones together, and the function of the muscles is to get the motion for you in this case. So knee pain is a common complaint that affects people of all ages. People think maybe it is an old age complaint, but it's not the case. So knee pain affects the people of all the ages, and for any single thing of importance, there are multiple reasons which can be there. We should know all this. So uh, knee pain can be because of these various reasons, and I'm going to cover most of them here. So if you have pain which is there, which is above the knee joint, that can be because of the muscles and their tendons like quadriceps and hamstring. If it is happening on the inner side of the knee, that can be because of the arthritis. If it's in the top, it can be bursitis. If it is at the kneecap, that is the hard bone which is on top of the knee, and you can feel it also. It can be patellofemoral syndrome or chondromalacia or patellar instability or stress fracture. So patella is the name of that bone, PATELLA, and all these are patella related causes. And if there is pain lower down, then it can be bursitis or the Hoffa fat pad impingement. So all these need to be diagnosed. Then if there is pain below the knee, then there can be sliding Larsen-Johnson syndrome. And also if there is pain where the patellar tendon inserts on the tibia, that is the lower bone, then it can be patellar tendonitis and various other disorders. Okay, now let's move to behind the knee. If you see from the back side, this is the front side and this is the back side. So if you see from the back side, there can be the hamstring tendinitis which can be there, and there can be various forms of arthritis or Baker's cyst. That is the knee fluid can come from the center of the joint through some tear and come behind and make a cyst. There can also be ligament injuries and tendinitis. On the inner side of the knee, it can be the pica syndrome, or if you see lower down, it can be meniscus injury or ligament injury, and it can also be bursitis. So bursa means there are lubricating sacs of fluid, and they may be inflamed. That is, inflammation can happen there. And also, if you see on the outer side of the knee, there can be iliotibial band syndrome, which is a taut band. Then there can be arthritis, meniscus tear, lateral collateral injury, etc. So, if you classify, simplify, this is very complicated, but if you simplify, the cause of pain can be either an injury or mechanical problems or some medical condition. And the more common injury which you might have heard, and I'm sure some of you might be the patients also. So these are the ACL injury, the fractures, the torn meniscus, the knee bursitis, and patellar tendinitis. So if you see these pictures, so this is the normal knee joint, this is the inflamed knee joint. So you can see there is a lot of fluid here, and pain because of these issues. Then there can be a fracture, there can be the tendinitis, there can be the tear in the meniscus, there can be the injury in the ACL and likewise. Okay. Now, if you see, there are the mechanical problems. That means the knee might be, this is the healthy knee, but then there, it can be subluxated or dislocated. So that means the bones are not in a perfect alignment and a perfect position, and there can be internal rotated, and you will be surprised that the foot also has a bearing on the knee. If your foot is having problems, you will get knee pain, and ultimately you may also get hip and back pain also, and vice versa. Okay. So these are the things which you need to understand. But there are some medical problems and medical conditions also, which can result in all these issues. And uh, this can be very difficult, and if not diagnosed properly, it can result in lot of damage to the knee joint. For example, we have a common complaint, this uric acid is there. Okay. So uric acid problem can be there. Then osteoarthritis of the knee, which is the commonest, one of the commonest cause of the knee pain is there. Then medical conditions can be there, like if you see, this is healthy joint, and this is osteoarthritis, this is rheumatoid arthritis. So all these conditions, they, arthritis means inflammation of the joint, but there are various causes of this arthritis which can be different medical conditions. Now we often call, there are young people who can be affected with something which is known as patellofemoral pain syndrome. And you'll be surprised that this can even happen to young patients, and they will have either a punch lesion or a arthritic patch, which will be concentrated here, and this will result in patellar pain. So this is patella, as I mentioned, this is your femur bone, and this pain will be probably most in the front. And the risk factors usually for knee pain are patients over 50, female patients, overweight patients, joint injury, repetitive strain. Means if your occupation is such that you are putting a lot of load on the knee, and also the joint structure which might be slowly degenerated. If you see, what are the types of ligament injuries, I have already described: anterior and posterior cruciate ligaments, that is there in the shape of the cross, and medial and lateral collateral ligaments. Okay. So if somebody is playing, say, football, and there is direct blow to the anterior bone, or there is a dashboard injury, means there is a sudden braking and you're not wearing a seat belt, and you go ahead, or maybe you fall into the flex knee with foot and plantar flexion. In that case, it can happen. Or if you get extended while playing, or you fall down, then it can happen. So pain and tenderness to the touch is the first symptom. Then it can be swelling and bruising, difficulty in moving the joints, trouble putting the weight on the joint, and these symptoms can get worse over time. So this is the meniscus. It is horseshoe shaped. And what is meniscus? Meniscus is this pad which kind of gives a cushion to the joint. And if you see, it can be torn in the knee injury, and also with age it degenerates. Okay. So this is very important to understand. And hence when you get an MRI, you will find various types of a tear which can be there. So this is, for example, healthy. Then this is a tear which is radial tear, and this is a longitudinal tear, there's a flap tear, there's a complex tear, then there's a bucket handle tear. So a horizontal, the various types of tear, you don't need to go into that, but just understand that there are various types of tears which are possible. And how do you know if you have a torn meniscus? So your knee would be swollen, it will be unstable, there'll be restricted range of motion. Some people say, "Arey, wo lock ho gaya," and then there can be frequent popping and clicking sensation. बहुत ज़्यादा कट कट हो रहा है. And of course, as I mentioned, knee will be locked, and you will get a sensation that knee is giving away, and there also will be pain, of course, with all this. Okay. So this is a picture showing the torn ligament, which must uh, be taken care of. And there are various ways to fix, in which the surgeons will fix the any of these deformities, and you can see one of them is being shown here. So I'm not a surgeon, but just to make you understand how these issues can be fixed, and in this case it has been artificially created. Okay, so the most common condition is osteoarthritis, which will affect all of us actually, but some of us will have pain, most of us will not have pain, or many of us will not have pain. But I will say all of us will have pain in the knee at some point of our lives. So it's very important to understand about this pain. So on your left is a normal knee joint. This you can see my pointer moving, and on the right is an arthritic knee joint. That means you can see there is the bone margins are healthy here, the bone margins are not healthy here, and there is no space in between these two, which says that the meniscus has already given away. And in this diagram you can also see the normal knee on the left side and the arthrosis of the knee on the right side, where you can see cartilage injuries, bone exposure, then osteophytes, then meniscus issues, and then fragments of cartilage which have come out. Okay, in the advanced osteoarthritis you will see all these issues which will be there in the knee, and this can be diagnosed on an x-ray when clubbed with the clinical symptoms. Okay, and you can see the anterior cruciate ligament which is here, and this might be torn in many cases. And inside the knee how it looks, so if we put a scope inside the knee, this is how it looks. This is a normal one, and if you see, this is the moderate one and this is the severe one. You can see the moderate arthritic changes are present here, but this one you can see the severe arthritic changes. So all the meniscus is torn here, and or maybe degenerated here, and then also uh, the uh, the bone is visible, and that is what you need to see. So doctors can classify the knee osteoarthritis based on the standing AP X-ray, which will put weight on the knee joint and show the actual position of compression which is there when a person stands. So they can be four grades, and the grade one is the simplest one, grade two most complicated one, the joint space reduced with chondral sclerosis, and also there can be the alignment problems which can be there. So osteoarthritis is among the most common joint disorders and is characterized. I think I'll skip this. I've already told you all of the things which are there in usual videos. So X-rays, the standing X-ray is the one which will give you a good amount of uh, diagnostic accuracy, and otherwise, if you lie down, this may be missed. Okay, and these all are the early signs and symptoms which probably you should not ignore for arthritis, not only in the knee but all over the body. So probably it will start with a clicking, cracking sound somewhere, and uh, there can be slow onset of symptoms or fast onset. Usually it is slow, and it gives you a lot of time. Maybe one day you have a mild swelling and then it gets better after some painkiller and all. So you think it's gone, but it will not go away. It will come again. So that means that in your list of schedule, this doctor visit should be there so that you can come and get it treated beforehand. So bone spurs, if you see on an X-ray, that is a red flag. That means bones have started to degenerate, and of course your reduced flexibility, your reduced mobility, and if you're not able to climb stairs, etc. This all must be taken care of. Now, how you can prevent this? So, of course, you cannot stop your age. Age will continue, but then you can check yourself for presence of any rheumatoid arthritis or uric acid abnormalities. Then you can keep your weight in check, because all the weight will be borne by the knee, and most of the knee injuries which happen, they are caused because you thought that you can do a lot of work, but actually your body is not ready for it. So how you can prevent that is by exercising daily. So if you exercise daily, not only you will strengthen the knee, but you will also know what is your capacity and how much work your knee can do. Okay, then the genetic orders such as deformed legs or knees, and this can also predispose you. In addition to it, if you are habitual of sitting on the floor, side bending, squatting, and also playing football, etc., and you know kind of you are aging. So these are all the factors. Okay, prevention is always better than cure. So try to when you have a baby, or you have some young family member, then you monitor and treat for hip dysplasia. Then prevent overweight and inactivity, give them good upbringing if they are young playing. So make sure that they're playing in the proper way after being trained. Prevent sports related knee injury, and prevent muscle weakness, overuse, and re-injury after injury. That is very important. And then prevent weight gain specific to the middle ages. And of course prevent age related sarcopenia and resulting muscle weakness which can be there. Okay, so I have given you good these things, but to summarize, just strengthen your muscles. Joint load will be less. There'll be less wear and tear, and specific muscles are to be strengthened for each joint. So for knee, for example, you have to strengthen the quadriceps group of muscle and hamstring group of muscles, but also the leg muscles, which will help the knee to unlock and lock. And also, if you see the for the neck, back, hip, shoulder, ankle, and elbow, you can also strengthen the specific muscles. Okay, so there is the doctors, various societies recommend various stuff. So one of the societies, it recommends strengthening exercises, low impact aerobic exercises, then aquatic exercises, and weight loss programs. Okay, so oils and balms which you apply, they are often like a band-aid on a broken bone. So they are too less and do too little. So what you will end up doing is they will give you a symptomatic relief, but that's about it. Okay, so if you have to then people say that physio, but physio is a great start, but sometimes you don't need more than just a warm up. So maybe many times physio will be inadequate. So if once your osteoarthritis has set in, then physio alone will not be able to help you out. Okay, please remember, there is not even a single physio who can help you out. So that is very important. Physio is an important part of your uh, recovery, but it alone cannot reverse these stages. So now I'll introduce you about this branch, which is very new but can help you out. So this is known as pain medicine, and it's a personalized new branch. And the practitioners, they are known as pain physicians or interventional spine and pain physicians, and they do minimally invasive procedures like spine endoscopies or spinal cord stimulators or ultrasound guided procedures, etc. And whenever it comes to surgery, always less is more. That means the lesser it is done, the better it is. More and more research is proving that we have uh, better results if we are minimally invasive. Okay, and we want, with the help of these procedures which I am going to tell you now, we are going to break this cycle. So just doing exercise and just doing, once pain has started, just taking some oils and balms and exercise, medication, it's not enough. So you need to do all these procedures. And if you break this cycle, that is, a person is having a pain in the knee or in the back, wherever, and then they cannot do certain activities, like they cannot climb the stairs or something, and then they keep on getting fat. If they get fat, they have more pain, more disability, more fat, more pain, and it continues. So we have to break it somewhere. So how we have to break it is, we take care of the pain. And if we take care of the pain, the people can exercise, and then we can go on from there. So at this point, I will want you to be ready with your questions, because we are going to take some question and answers also. And please feel free to ask any kind of questions. Only I will not be able to prescribe medicines or give this on the, but you can ask generalized questions. And don't feel scared. Any question is more than welcome. Okay, so let's go on with these treatments. So another good treatment is this offloading knee osteoarthritic braces, which are underutilized, at the moment, I feel, because it is very difficult to correctly wear them. and you have to buy this brace, which some people consider as expensive. So maybe it will come for say 15,000 or whatever. And people think that this is a, a very expensive brace, and then they go on Amazon and they buy similar looking models. So what is an offloading brace? So offloading brace is a brace which kind of takes the weight of the body from here and bypasses it and puts it here. Okay, so it's kind of a bypass to the knee joint, and in doing so it also converts some of the this weight into an inward uh, push, so that the person's legs can be straightened. And I feel it is quite underutilized. And in patients with osteoarthritis, they can greatly benefit from this. In fact, some people report a good amount of relief with these braces alone, but usually we combine this with other treatments. Okay, so what can be these treatments? For example, if these patients are having some knots in their muscles and they have the myofascial pain, so we can give something known as trigger point injection. In this, we just see the ultrasound of the patient, and then inside the muscle, we give these guided injections. And after these injections, the patients feel much better for a long period of time. Then the second option which we have for these patients is regenerative treatment. And here we are going to give the platelet rich plasma or stem cells. So whenever you hear the word stem cells, you should always be conscious, because there is no real stem cells. What we are actually using is that this is the bone marrow aspirate concentrate. So this is very important to understand. And then we have certain scaffolds where the cartilage scales can be grown in the patient's own body. And how we prepare this is by centrifuging the blood. And we can take either the BMAC, or we can take the blood, and we can centrifuge and get the platelet rich plasma, which has all the growth factors which are required to heal. So once we give this inside the patient's joint, the joint starts to um, uh, repair itself in the way that the inflammation goes down. And in some cases, mind it, not all cases, the cartilage growth can restart. Okay, and people have published literature with the MRI documented growth in the cartilage. And but of course it is not a 100% thing. Means it doesn't mean that everyone will benefit from the same treatment. Okay, so how we put it is very important, because we need to be sure that we are putting it in the correct spot. So we take the needle and we put it inside, and you can see this, this is a tendon, and this is a needle going inside. And if there is a tear, or if there is a damage, or there is an arthritis, you can actually pinpoint and target under the ultrasound guidance. Okay, so this is a treatment that uses your own blood to treat the damaged tissues. Okay, you can also use hyaluronic acid injections, and nowadays we have very good products which have both the things. That is, in the same knee, you can put in the same syringe. You have the hyaluronic acid, and you can add the PRP and inject it in the knee joint, which will give good results. So one of the very important techniques which is available now is the cool radiofrequency ablation, which can be fluoro and sono guided. Herein, what we do is we numb the nerves which carry the pain sensations from the capsular portions of the knee joint. And the patient, this can be done under ultrasound guidance or in fluoro guidance. You can see this is me doing this procedure. And in
Can't
one of
hear.
the, yeah, everybody can hear Mr. Ramesh. Can you
Yes,
just
sir. You are audible. I sent a message also, ma'am. Please check from your
Okay, okay.
side.
Maybe she has some issues with
Yeah,
her microphone. Okay,
you go ahead.
or so speakers rather. Okay, so all these intervention procedures are available. So I have not mentioned surgery anywhere. You can see. So the combination
I
treatment has
can't
best
hear.
results. So you need to understand that, ma'am, can you be quiet? Everybody else can hear. Okay, she cannot hear me, so she can't listen to this also. So interventional procedures are available, and combination treatment gives the good results. And I have not mentioned surgery anywhere because we want to give a surgery free treatment. That is possible if the patient comes in early, and it's not very expensive, can be repeated, minimally invasive. So remember, don't let your knee pain hold you back. And uh, we are always available to help you. With these words, I would like to